Hello, good afternoon, everyone. My name is Ugo Osigwe, and I'll be speaking on seeking evidence on behalf of AFENET Nigeria. Now, by way of background, AFENET is a non-profit networking and service alliance of field epidemiology and laboratory training programs across Africa. And AFENET Nigeria country operations commenced in 2008 with the establishment of the Nigerian Fertility Program. And since then, we've been instrumental in supporting the entirety of the public health space in Nigeria, with strengthening of capacity for surveillance, eradication of polio efforts, and we're also in HIV, and of course the rollout of the DHIS2 RR module across the 36 states of the country. Now, about the project in particular, we're funded by BMGF to conduct a strengthening data quality to improve immunization and primary health care program performance. And it's basically using a human-centered design behavioral science approach to drive data quality improvement and data use culture across all the PhD thematic areas. And this stems from the long-standing concern around poor administrative data quality observed by the systemic and persistent discordance in PhD service indicators between facility and survey data. So this project aims to motivate and incentivize states to improve data quality, specifically accuracy, completeness, and data use. And the theory of change relies on the Fox model, which states that you require motivation, ability, and triggers for it to be able to generate change. So why does this step matter? This step is the key step that provides the opportunity to obtain feedback data that is targeted at answering our key learning questions and not just collecting data for accountability. See, so in planning this, there are some crucial assumptions made and risks associated with strategies that at this step is where the data, that's the evidence, is collected that will provide the learning around these issues. So it's important for us not just to know if the intervention is working, but to understand why it is or why it's not working. And it is this evidence, if not properly collected, or if the correction is not properly designed around these interventions, the data then will not be able to inform decisions. So seeking evidence for decision making is a crucial step, especially for us in this project, considering the new approaches and strategies that we are applying. What makes this difficult? So, of course, difficulties would occur, and they could be technical, probably due to conflicting needs and requests from various stakeholders, the capacity and the volume of the tools. So we're trying to prove data quality, and then of course we know the issues that are associated with those DHIS2 and the NHMIS tools. And then of course it could be challenges due to being able to actually elicit frank and honest answers, difficulty in ensuring accurate feedback is collected and analyzed. And then of course it could be poor response from proposed respondents, leading to inadequate information. And importantly, we need to have the expertise to develop and deploy RFMs to generate new ideas, run experiments, and collect appropriate data. And this usually involves additional costs, which may not have been planned for or originally budgeted. So how did we seek evidence? Using responsive feedback mechanisms. So we designed 6 responsive feedback mechanisms around these 3 themes of motivation, ability, and triggers, to receive direct simple feedback from the healthcare workers using a variety of methods on a continuous ongoing basis. And so this data around each of these items is what the project team uses to learn if the intervention is working, and if it is not working, why it is and why it is not, and then provide the evidence that we require to correct it. So this ensures that throughout the project program cycle, that data is continuously generated around this intervention that generate learning that improves program decision making. So lessons for others on seeking evidence. So the first thing is to identify and select your learning questions, and this should occur as early as possible, preferably at the proposal phase. And then of course convince stakeholders to understand their needs and expectations. So we're going to be using RFMs and how the decisions that are going to be based on the evidence will be made and how they will affect program implementation and performance. And then of course there should be a plan from the beginning to iterate on proposed interventions based on this evidence. It means that flexibility and learning should be integrated intricately into the program design. Okay. Thank you.